Hello, my name is Dylan. I'll be your nurse for today. First things first, can I get your name and date of birth, sir?
Yes, Pedro Bello, 030293.
Okay, great. And then, do you have any allergies by chance?
No,
No allergies? Okay. So what brought you into the hospital today?
my back, lower back is hurting.
Okay, lower back pain? Gotcha. Well, how many days ago did this occur?
It's been like 4 days.
Okay. Were you doing anything when did you injure your back in any kind of way or anything?
Yeah,
Or-
yeah, I was lifting weights.
Okay, gotcha. And then as far as the pain 0 to 10, what is your pain from 0 to 10, would you say?
I would say like a 6.
A 6? Okay.
Yeah,
Does it rate anywhere or is it pretty much stay in the lower back?
it's mostly just the lower back.
Okay, gotcha. And is there anything you do to necessarily like relieve the symptoms, make it feel better at all, or?
Yeah, I just like laying flat and resting.
Okay, so with rest it feels better? Okay, gotcha. And then as far as, so you said it just stays in your lower back, essentially doesn't really go anywhere? Okay. And so you said, okay, do you know where you are right now?
The hospital,
Hospital, okay. Do you know what the date is?
I think it's Thursday.
Yes, sir, that is correct. Do you know who the president is?
Biden,
Yes, sir. And then what brought you into the hospital today?
just my back, that's been hurting.
Back pain? Okay, perfect. First thing I'm going to do, sir, I'm going to take a complete set of vital signs on you. So I'm going to ask for your finger here. That's going to get your temperature. That's going to get your temperature and your heart rate there. And then, let's see. Okay. Let me see what it says. Oh. Okay. All right, good stuff. So your oxygen is 96 and your heart rate is currently at 80. Okay, awesome heart rate. Okay. And take the blood pressure, sir.
Yeah.
Okay. Does that feel pretty snug?
Yeah.
Good. Okay. And what does your blood pressure normally run, sir?
I'm not sure, I don't normally go to the doctor, but I think it's always been like normal.
Okay, normal? Okay, gotcha. I'm gonna pump up to 180. All right, blood pressure is 122 over 80. Really good blood pressure. All right, let me take these off real quick. One moment. Okay, and then Leslie, let me get your temperature real quick. Okay, 96.8. Okay, all righty. So first thing I'm going to do a head, ears, eyes, nose, and throat exam on you. First thing I'm going to do, I'm going to check your scalp. I'm going to be assessing for any abnormalities, any redness, anything out of place. Let me come around. I'm checking for lesions. I'm checking for any pressure ulcers on the back of the scalp, making sure that the scalp is round and head is normal cephalic in shape. Okay. Do you have any pain or anything like that in your head at all?
No.
No? Okay. Alrighty, sir. So I'm going to look into both of your ears. Let me get a new one on here. One moment. Okay, sir. I'm going to pull your ear up and back. Okay. Oh, lost it. Okay. Let me get one more on there. Sorry about that, sir. Okay, pulling it up and back. Okay, not seeing any excessive ceramin. Tympanic membrane looks intact. I'm gonna ask that you take off your glasses for me, please. Okay. First thing I want to do, I'm going to assess your sinuses. Please let me know if this hurts at all upon pressure. Okay. And then I'm going to look up for me. I'm going to pull your eye down. I want to be assessing if the sclera is pink, moist, appropriate color. Okay. Okay, sclera looks good. All right. And then I'm going to ask that you look up for me. I'm going to look into your nose, sir. Tilt your head up. I'm sorry. Making sure that the nares are patent. I'm assessing if there's any deviated septum or anything like that. Okay, nose looks good. And then lastly, let me see your mouth. Open up your mouth for me, sir. Say ah real quick. Okay. All right. Assessing for any lesions, cavities, anything like that. Do you have your tonsils still?
Yeah.
You just have your tonsils. Okay. Gotcha. I will now be doing cranial nerves. So we're gonna start with number 1. Can you close your eyes? I'm gonna give you something to smell and you will let me know what you smell, okay?
Yeah.
Okay.
Alcohol.
Alcohol, perfect. So that's number 1, that's olfactory. We're now going to do, you're okay to put your glasses back on. Let's do cranial nerve number 2, which is optic. What I'll have you do is first with your right eye, let's read I want you to read this line right here for me.
8745.
Okay, great. And then now with just your left eye, please, sir, I'll ask that you read that same line.
8745.
8745, okay. All right, and then with both eyes, please, will you tell me?
8745.
Perfect, okay. All right, so now we're going to assess cranial nerves number 3, 4, and 6, which is oculomotor, trochlear, and abducens. So first thing I'm gonna do, I'm gonna have you look straight ahead, sir. I'm gonna check your pupils here. Okay, awesome. Okay, all right. So you're gonna follow my pin light and please, without moving your head, follow it, okay? Awesome. Pupils are equally round and reacted to light and accommodation, which is good. We are going to do number 5. This is going to be trigeminal, right? So what I'm going to do, so this is going to be soft and this will be hard. Please let me know what you feel in your face. I'll have you close your eyes for me. Okay.
Soft.
Okay.
Soft. Hard. Soft.
One more time.
Hard.
Okay.
Soft. Soft.
Okay, awesome. And then what I'm gonna have you do, so please clench and then open your jaw for me. One more time. Do you have TMJ? You have any clicking in your jaw or anything like that?
No, that I know.
No? Okay, all right. So now we'll go to facial. I will have you smile for me, sir. Okay, perfect. And then puff out your cheeks and then raise your eyebrows. Okay, awesome, good stuff. So that's number 7. Now we're gonna do number 8, which is gonna be olfactory. I'll have you close. Please put your hand over your right ear. I'm gonna whisper 3 things to you. Please let me know what you hear, okay?
Alpha Bravo Charlie.
Okay, now you're gonna close the other one and I'm going to whisper 3 more words.
Dog, cat, apple.
Okay, awesome. So that is cranial nerve number 8. Let's see here. So now we're going to do 9 and 12. Please do me a favor. So stick out your tongue again. Say ah for me. Okay. Checking hypoglossal and glossopharyngeal, and then last, can you stick your tongue and wave it side to side for me, sir? Okay, perfect. And then I'm going to, let me get my tongue depressor here. Please open up your mouth. I'm going to project vagus for the gag reflex. Okay, all right. Gag reflex is there, so that's great. And then now I'm going to check in cranial nerve number 11, which is going to be spinal accessory. So what I want you to do, raise your shoulders against my hands. Pressure, perfect. And then same, turn your face into my hand, please. Okay, and then the other side, please. Okay, awesome. All right, so that's going to be, those are going to be the cranial nerves. That's cranial nerve number 11, which is spinal accessory. I'm now going to move on to your lung sounds. So let me get my stethoscope here. I'm going to ask that you, I'm going to take a deep breath each time, okay? All right. Okay, so take a deep breath in. Again. 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 Here, that was a little too low. 1 second. Let me do it one more time here. Okay, one more time. Okay, again. Okay, anterior lung sounds sound clear. What I'm gonna have you do is I'm gonna have you flip around for me. That way I can assess your back, okay?
Yeah.
Okay, I'm wanting to assess and palpate the back. Do you have any tenderness or anything when I press on your back here, sir?
No.
No? Okay, no pain? Okay.
Just on
making
my
sure there's no
just on my lower back.
lower back only. Okay, gotcha. So up in the upper back area, we're good, but then lower back. So is the pain kind of, can you point to where the pain is in your lower back, sir?
It's just like, generalized.
Okay, so it's here. Is there any pain when I just touch on it like that?
A little bit. It's mostly like a movement, what.
Okay, so mostly movement activity, that kind of thing? Okay. All right. So I'm gonna listen. So breathe in for me. Again. 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 And one more time, sir. Okay, all right. Posterior lungs sound clear. All lobes are sound great. Okay, so all I have you do, bud, is I'll have you turn around and face me. I'm now going to move on to my cardiovascular assessment. We're going to be listening to the heart valves. Okay, so making sure my stethoscope works properly. We are going to start with aortic. Moving on to pulmonic. One intercostal space down to Erb's point. Tricuspid. And then finally mitral. Okay, awesome. I'm gonna listen to your pulse real quick.
Okay.
Listen for 1 4 minutes.
Sorry.
Oh, no, you're good. I'll just put it on the table here, sir.
All right.
Okay. All right, I'm gonna listen to your pulse for 1 full minute. Starting now. pulse is 72 and your respirations are 14. I'll give you the watch back if you want to put it back on. Okay, perfect. Okay, awesome. All right, so now what I'm gonna have you do, I'm gonna have you lay down for me. I'm gonna listen to your heart valves one more time. So, upon having the patient lay down, I'm assessing for a jugular vein distension. All right, sir, and then I want to also check your carotid on each side. Checking for strength. Okay, and then same, I'm going to listen to your aortic, pulmonic, Erb's point, tricuspid, and finally mitral. Okay, alrighty. So I'm now going to assess your abdomen. I'm going to inspect the abdomen for any distension, any bloating. Have you been having any difficulty passing having bowel movements or anything like that?
No.
Okay. When was your last bowel movement?
This morning.
Okay. Was it pretty normal from what you could see?
Yeah.
Okay, so I've inspected the abdomen. I want to now listen. Right lower quadrant. Right upper quadrant. Left upper quadrant. And finally, left lower quadrant. Okay, so, all right, sir. So now I'm going to palpate lightly. Please let me know upon doing this if you have any pain or discomfort, okay?
Yeah.
Okay, I'm going to be going into a circular motion. Okay. If you feel any pain throughout, just please let me know, okay? Okay, I'm going to now use a little bit more pressure using both hands. Please let me know if you experience any pain or discomfort, okay? Okay, perfect. I'm going to now check your legs, sir. I'm going to roll up your pant legs here. Okay. I'm going to be checking for any edema, also checking for color, making sure it's appropriate for his skin tone, like so. I'm going to now check your posterior tibial pulses bilaterally, making sure that they are both strong and equal. Okay, so stick your feet like straight up for me. Yeah, there you go. Now I'm going to listen to your dorsalis pedis. Wow. Oh, yeah, you have good foot pulses, sir.
Mm-hmm.
Yeah, real good. Real nice and strong. Okay.
Oh, okay.
Okay, so now let me check your cap refill on your toes here. Make sure that return is within 2 seconds. Okay, all right, sir. All right, I'm gonna roll your pant legs down real quick. All right, so what I'm gonna do now is I'm going to do a musculoskeletal. So I'll have you sit up for me for just a moment. And then we'll do range of motion, right? So I'll have you stick up your hands straight up in the air for me, sir. And then we'll go to the sides. And then finally behind your back, sir. Okay, awesome. And now I don't want you to assist me. What I'm gonna do is I'm going to grab your arm. Please let me know if you experience any pain or discomfort. I'm assessing the joint for stability, making sure that the arm moves as it should. Any pain or discomfort upon doing so, sir? Okay. I'm gonna now check the other arm. Okay. Okay. Any pain or discomfort upon doing that? Okay. Alrighty. One thing I did forget, I forgot to assess your bladder. Have you had any issues as far as holding urine, or have you been peeing like normal pretty much?
Yeah.
Okay, gotcha. So I'm gonna have you do, first thing I'll have you do is I'll have you walk please a couple steps out and then back to the bed, sir. I'm gonna be assessing for gait, making sure it's normal. Okay, come on back. Okay, and then I'll have you touch your toes if you don't mind. Sorry about that. So I'll have you touch your toes.
It's gonna be a little difficult with my back pain.
Okay, a little bit difficult with back pain. Okay, as far as you can go, sir, with the back pain, sir. Okay. So pretty bad. What would you say your pain is upon? What does your pain go to whenever you're doing that, sir?
It's like a 7 or something.
Like a 7? Okay, so bending down causes it to be pretty bad.
Yeah.
Okay, gotcha. So take a seat for me, sir. I also want to be checking your patellar reflex here. I'm gonna feel for the soft part of the knee. Okay, ready? Okay, one more time. Okay, good. Okay, ready? Okay, all right. Knee reflex is good. Okay. All right, and that completes my assessment. Do you have any questions or concerns going forward?
No, not right now.
Okay. All righty. Thank you, sir.
Thank you,
Appreciate you.
appreciate it.
Huh?